we're going to ask Dr. Cory Goldberg why men are starting to do a lot of cosmetic procedures, especially liposuction. Simply put, guys are more mindful of their body and they're healthier, and sometimes those love handles just won't go.
If I wanted to lose some of this fat around my midsection, what is involved?
So it's a great question, and one that a lot of guys ask me, because for men, this is the problem area, where for women it tends to be lower thighs. For guys, it's the spare tire. No matter how much weight you lose or how much you exercise as a guy, you're going to retain fat there, and that's just our genetics. I personally had that done because I went through my own weight loss journey. I lost 50 pounds in 2010. It took me 2 years, diet, exercise the right way. I got to the end of that and I still had this fullness of my chest and around my midsection. I went to see a colleague and I had liposuction and I had some tissue removed from my chest. It was life-altering. And liposuction is a really easy procedure to recover from. For a midsection, it's about an hour and a half, maybe 2 hours. I usually do that under a general anesthetic, although you can do liposuction under local or with sedation. It's not very comfortable, so I prefer having patients asleep so that it's an easy process for them. Afterwards, for the incisions to do this are very small. I mean, liposuction, the way that it works, it's a very long, thin tube. We call it a cannula, 3 to 5 millimeters in width. So to put that in, to suction the fat out, you really need an incision that's about 3 or 4 millimeters, and that's it. And typically for a midsection, I might put in, one on each side. I sometimes have to put 1 or 2 extra to get some other areas of fat, but each of these incisions are only a few millimeters, makes for tiny scars, which are very acceptable. And once they've healed, you really can't see where they are.
And recovery time?
Recovery time. You're looking at about 3 to 5 days of recovery at home and taking it easy. 2 weeks before you go back to the gym. And for those 2 weeks, you wear a binder around your midsection just to help keep compression. After the 2 weeks, I let patients decide if they want to wear it or when they wear it, but then you're back to the gym and back to normal.
What are the risks?
Risks of liposuction. So it's a general anesthetic or some kind of anesthetic. So there's small risks with that. Most guys coming to me are pretty young, healthy people, so that's not much of an issue. Other than that, it's more cosmetic things, such as the scar may be a little bit thick after it's finished healing. That's not typical. I've never seen an infection with liposuction, but infection can happen with any kind of surgery. With liposuction, there can be irregularities. So sometimes a little bit more fat comes out from an area than another. Fat is not always symmetric and it doesn't always come out evenly. So there can be contour irregularities that are left from that.
Is this a once in a lifetime procedure?
Typically once. As long as you maintain a healthy lifestyle, you're going to maintain your weight, you're going to maintain your shape. And a few pounds fluctuation here and there is not a big deal. However, if I did liposuction and you gain 20 or 30 pounds next year, that will make a difference. That would definitely cause some of this to come back again. But in the end, no matter what, even if you did gain a bit of weight, you'll always have less there. It will be a benefit no matter what. But my advice is be good. Once you're investing in yourself, you want to maintain that.
So on the other side of the coin, what if I don't get this removed and it sits around my midsection for the rest of my 60s and 70s? What are the health concerns there?
Well, I guess first off, I would say you're a very handsome guy, so I think you're going to be okay. But in the end, it's really an aesthetic thing. So doing liposuction doesn't change your risk factors. So taking fat out from here, it's not a weight loss strategy because in the end, the weight that's being removed is only a few pounds. So taking that off is not going to suddenly drop you 10 or 20 pounds. And additionally, it doesn't change your heart, cardiovascular risk factors or your cholesterol. So it's an aesthetic thing. It's changing contour and shape, and that's really about your, how you feel about yourself. But your overall health is still in your hands. It's still up to you to maintain that, good diet and lifestyle to keep your cholesterol and all that under control.